name is Julie Aworotieno. I'm the clinical psychologist here at Aga Khan Hospital, Kisumu. So today we are celebrating the Breast Cancer and Cervical Awareness Month. As you know, October is the month for this. And today we are doing screening. It's free screening for women of all ages, just to check on issues to do with breast cancer, to get them, we are giving them awareness in terms of understanding symptoms, understanding what screening is all about, what diagnosis is all about, and even the aftercare in case something positive comes up in the screening. So as a clinical psychologist, my aim here or my purpose here is basically to help with what we call supportive care. Post-diagnosis, if at all someone has a positive screen, that means that they have either a breast cancer or a cervical cancer. What you do is psychosocial support. Psychosocial support entails giving the patients the best support that is there in their cancer journey, and also for their carers, that is the ones who are giving them the care after. On top of that, we also do what is called spiritual counseling, which involves our oncologist nurse, okay? And sometimes we do call in the spiritual leaders if at all there's need. We are targeting at least around 250 and above women for today. So far, I wouldn't know the numbers as of now, but we have served quite a number because we started at around 8:30. So, and as you can see from around, we have quite a number here. Yeah.
How many days?
It's only for today. It was starting at 8:30 up to 1, but from the look of things, looks like we might go up to the end of the day. Yes.
My name is Mildred Oluoch. I am a nurse by profession. My specialty is oncology and palliative care nursing. Today, my main role here is doing breast examination to the clients that have come for this special event.
We've been told for screening, doing health talks. What is it about, and what kind of messages are you sharing with the patients here?
The health talks we've provided is mainly the common cancers that we get worldwide and also in this region of Kisumu. The most common cancers are the breast cancer, cervical cancer, prostate cancer. We've talked to the clients about what causes cancer, the signs and symptoms, so that at least they may know what signs and symptoms that they see or experience that would need medical attention.
My name is Alfred Mayan, an oncologist based at Aga Khan Hospital, Kisumu. So we are here today because this month is Breast Cancer Awareness Month, and globally breast cancer is the commonest cancer. Over 2 million women do get breast cancer, diagnosed with breast cancer each year. New cases of breast cancer worldwide. Even in our developing countries and middle developing countries like ours, breast cancer is one of the commonest cancer in women, followed by cervical cancer. So, as I said, that is why we are here. Aim of today is just to create awareness and do some screening. The theme for this year, breast cancer, is about close the gap. And we are talking about closing the gap by creating awareness to our female, our women, making them access the screening, know the symptoms and the signs, treatment, and follow-up for breast cancer. So as I have said, breast cancer is the commonest worldwide. 40 years, from 40 years of age and above, that is where we see many women coming with the breast cancer. This is as per global data. But in African settings, in African women, we see many women 10 years earlier than the global statistics, meaning we see many patients coming with the breast from 30 years and above. So unfortunately for developing countries, most women present with the late disease stage, stage 3 and stage 4. We know for all cancers we have stage 1, stage 2, stage 3, stage 4. The higher the stage, the difficult is cure. So we see many women with the advanced stage because of several factors, one being, like as we have said, lack of awareness, lack of knowledge on the signs and the symptoms, not access the screening, not access the treatment and diagnosis and the treatment. So as Aga Khan Hospital, we are just joining effort with the government effort and the other organization to close this gap, as we have said, in creating awareness, and we will be having screening for both breast and the cervical cancer, as also cervical cancer is the commonest